Hi, everyone, and welcome to episode 14 of the Tick Bootcamp podcast. The title of today's interview is Childhood Stolen at Birth, an interview with Zara Toohey. My name is Richard Johannesson.
And I'm Matt Sabatello.
Today's podcast guest is from the land down under, Zara Toohey. Ms. Toohey is a young woman from Australia who suffers from chronic Lyme disease. Ms. Toohey believes she contracted Lyme disease in vitro. She was diagnosed with Lyme disease when her father, who also suffers from chronic Lyme disease, was in San Francisco for his own Lyme treatment, and his doctors recognized Zara's Lyme symptoms. Unfortunately, Zara's Lyme diagnosis was too late to prevent her from losing the ability to participate in dance classes, hang out with friends, or attend school. Zara was inspired to start a beautiful Instagram, Limelight, to document her life with a chronic illness. Without censors, Zara shares her hospital visits, her fatigue symptoms, her use of acupuncture for pain management, and her hypothermia treatment experience. By sharing elements of her Lyme journey, she reminds others they are not alone, comforts people with chronic diseases with the mantra, for every fall, there is a rise.
Zara, thank you so much for joining us today on our podcast.
Thank you for having me.
Can you start by describing what your life was like before you started having symptoms from Lyme disease?
Yeah, so I loved dancing. I would dance 5 days a week, and that was like my whole life. That's what I thought I was going to do with my life. I was a big social butterfly. I really enjoyed being around friends and families and riding my bike and going to the beach. I loved life, you know.
So it sounds like you had a beautiful childhood. At what age did you start to begin to experience Lyme symptoms?
I started experiencing symptoms basically from birth. It started with I had a really terrible stutter when I was about 2, and I was always such a restless baby, and like I would go on days, like 13 days crying, and no one could ever know why I was in such distress. And then I started getting more of the classical symptoms when I was about 10, when I started to have really terrible pain in my stomach that no one could diagnose. I was constantly going to hospital for these pains, and I would always leave without an answer. They would say that it was appendicitis or IBS. So they never knew what the cause of that was. And I went to so many doctors, and no one could diagnose it. So they brought it down to mental health issues. They thought that it was all in my head, which is lots of Lyme patients go through.
Unfortunately, that is not rare. Many Lyme patients, like myself, have been misdiagnosed with various things, such as mental health illnesses and brain tumors and other types of things like IBS. So it sounds like when you were 10, you really started to not feel well and started to struggle with seeing your doctors. How did that progress up until you actually found your Lyme diagnosis? Can you talk about that lead up to that and what your diagnosis was like?
Yeah. So my symptoms got really bad when I was 13, going into high school in 2014, where my body and joint pain was almost unbearable. I was having horrible pressure in my head, and I started getting really horrible chest pains. And all these symptoms caused me to basically be bedridden and not be able to attend school or anything like that. So when I was 13, my dad was over in San Francisco for treatment of his chronic Lyme disease. And the doctors there saw and diagnosed me with Lyme disease. That was very lucky for me. And they tested me with the CDC, and I tested back positive for Borrelia, Bartonella, and Babesia.
So not only were you sick with the Lyme disease bacteria, you had other infections and illnesses from the tick bite as well from your parents.
Yeah.
Right?
So, Zara, can you talk to us a little bit about that? Do you know if you were bitten by a tick, or do you believe that the tick bite that either your mother or your father had suffered was what caused you to contract your Lyme?
Yeah. So when I got diagnosed with Lyme disease, they originally thought it could be from a tick bite, But through further down in my experience with Lyme disease, they brought it down to that it was chronic Lyme disease, because I've only been bitten my whole life once by a tick, and that's when I was probably about 6 years old. And because my parents, but my father was very sick with Lyme disease, we knew the symptoms to look out for and the classic things, and I went on, antibiotics, which is the typical regime here in Australia, because we live in a very tick-infested area. So, yeah.
So, Zara, you feel very confident that you contracted Lyme disease before you were born, and not as a consequence of a tick bite.
Yeah, because the symptoms that I had as well, like OCD and things like that, and the stomach pains as well, are very classical of someone who had gotten it in vitro from birth, because they are the symptoms that usually show up really early stages of it, and it usually comes in the time of puberty, and that's when my symptoms started to come out when I was 13, and they came out for no reason, not like there was no tick bite around that time, and so the doctors are very confident that I received it from birth.
There are many stories like yours, Zara, out there on the internet. One of them from LymeDisease.org's blog, another young woman who was diagnosed with Lyme disease, and her doctors believe it to be transmitted at birth as well. And there are more and more studies showing evidence that this is very possible, pre-birth, to get Lyme disease from your parents pre-birth. So I think that as time moves on, we'll see more and more evidence and studies suggesting that.
Yeah, definitely. I hear a lot of stories of people reaching out to me who have got it from birth with very similar symptoms. So there's no doubt that...
Zara, you indicated that you live in a community that is tick-infested. Is the tick problem a big problem in Australia generally, or is it just in the community where you live?
Oh, ticks are a huge problem in Australia. The area that I specifically live in, there's ticks everywhere. So all of us spray our backyards, and we're all very careful about ticks. And Australia's a huge issue. Like, when I've been overseas receiving treatments, nearly all the people in the waiting rooms are from Australia, because we can't receive treatment in Australia because they don't believe that Lyme exists. We have to seek treatment from different countries, like countries that do believe that it exists, which is crazy. But so having it be such a big issue with the ticks, it's a bit hard to believe that they don't believe it exists.
So in Australia, you're saying that they don't believe Lyme disease exists where you live, yet you live in a tick-infested area, and when you go seek treatment outside the country, you're seeing a bunch of fellow Australians in the waiting room with you seeking treatment outside the country.
Yeah, definitely. They believe that Lyme disease is a real thing, but they don't believe that we can contract it from Australia. They believe if we live in Australia and we have Lyme disease, we would have had to gotten it from a different country. And
understood.
Like, you can just walk down the street, and if I'm looking unwell, I've had people come up to me and say, "You don't have Lyme disease, do you?" Which is crazy, because nearly everyone you meet has it or knows someone who has it.
So it's that common in Australia, where everybody seems to know somebody that has been infected by Lyme disease.
Yeah, 100%.
And it seems like it's almost the same, if not worse, than it is here in the States, where the government and all of the big research companies really don't believe you can get it from a tick bite in Australia. You can only get it from leaving your community and getting infected elsewhere, whether it be the States or Europe or another community.
Yeah, that's very correct. But the thing that the people of Australia, I think, have the problem with it is, if you were to contract something like malaria overseas, they wouldn't you wouldn't come back to Australia, and they wouldn't not treat you just because you got it somewhere else. So that's the really tough thing for us to deal with, that, you know, even if we got it somewhere else, we are citizens of Australia, and they still refuse to treat us, and which is crazy. Even though all of us have contracted it from Australia. I know people who have Lyme disease in Australia who have never left Australia.
So, Zara, what about your parents? Did either one of them travel out of Australia to a tick-infested community prior to your birth?
No, they did not. My father, between when my sister and me, so between when my sister was born and when I was born, a tree fell on top of him, and the tree was full of ticks, and he got bitten by about 100 ticks. So he had like a poison overload in his body because he was bitten by so many ticks. And then shortly after that was when I was conceived, because there's no information about it in Australia unless you have it. Like, that was the first time they'd heard of it. But luckily his local GP picked it up because he had heard about it. So he got him tested, and then he got treatment. But because they believed he had so much, because he was bitten by so many ticks and he had such a large infection, he couldn't combat it, and so then it turned out to be chronic.
Yeah, we've heard so many stories there of people who get a late-stage diagnosis of Lyme disease, and we know the odds are much better with an early diagnosis that you can be treated and not have lifelong symptoms. But it just seems here in the States, and even in Australia, it's even worse, that it's very difficult to get diagnosed early on. And once you get a late diagnosis, you're very likely to have chronic, lifelong, problems with your health. And that's just such a travesty.
Yeah. I unfortunately got a late-stage diagnosis because my parents were not alerted or did not know that it could be passed down in vitro from birth. So, and they didn't know the symptoms or anything. So there was no way that they could have known. So I didn't get diagnosed until I was 13. So that I had it in my system for 13 years. So there is a lot of damage to my nervous system as a result.
Now, you got diagnosed at 13 years old in San Francisco, and you mentioned that in Australia, even if you get infected with Lyme disease outside of Australia, they still won't treat you. So now that you got diagnosed and you had to go back home, what was your treatment protocol? How did you get treatment for Lyme, knowing that you had it and having all the struggles you have in your home community?
Yeah. So my father was seeing a doctor called Dr. Schofield, and he is a Lyme literate doctor in Australia, one of the very, very few Lyme literate doctors, and we're very blessed that he lives quite close to our house. So my father had been seeing him for quite a few years, and so after we got that treatment, we came back, but he wasn't taking any new patients, as he already had thousands and thousands of patients, which he had to get better. But he heard my case and how complex it was, so he decided to take me on, which I'm so grateful for. So when we got home, I straight away went on a course of not like, the typical antibiotics like Bactrim and doxycycline. But I went on them for a short time, and the normal amount of time, and then I would get a bit better, but then as soon as I would come off the antibiotics, I would just get sick again, and then we'd go back on, and I'd get a little bit better, and then I'd get sick again. So after that is when they brought it down that it was probably chronic, as I wasn't getting better from the antibiotics, and I was on the antibiotics for a few years, which is a long time.
Sarah, I think that's we've heard that from many other guests and people we've spoken to, that they go on these oral antibiotics. They go on these combination therapies with different types of antibiotics at the same time. And as soon as they go off, they feel worse. And they go back on, feel a little bit better. As soon as they go off, they feel worse. And that seems to be a pretty common thing among a lot of our guests. And then they start to look for alternative treatments because they're on this antibiotic treatment for so long, and it just takes such a toll on their bodies that they seek alternative treatment. So how did you proceed once you realized the antibiotics weren't working and you weren't getting better and you had chronic Lyme? What were your next steps with your Lyme litter doctor?
So my pain was getting a real issue at that point. So we decided to go down the route of trying to get that under control, as that was my worst symptom. So we got to the stage where I had to start taking painkillers, which wasn't a path that we wanted to go down, as it's not, a great path, but that we really had no other choice because I was in, such agony 24 hours a day. So we went on painkillers and different anti-inflammatories to try and get those markers down, and we tried CBD oils and other tinctures, but I still wasn't getting better. So they decided in 2017, we decided to travel to Malaysia for hypothermia treatment with Dr. Radzi. Hypothermia treatment is a combination of antibiotics along with extreme heat up to 42 degrees Celsius, and that is supposed to kill the Borrelia and the co-infections.
Zara, tell us, how did you find Dr. Radzi and his hypothermia treatment?
My Lyme literate doctor had been sending a lot of patients there, and they were coming back with great results. Like, a lot of them were getting a lot better after being sick for lots and lots of years. Dr. Radzi had never treated someone as young as me, so he was a bit skeptical to take me on board. But after having all the tests and making sure I was fit enough to undergo the treatment, he decided to take me on, which I was very grateful for.
I'm sorry, Zara, can you share with our listeners what that experience was like? How did the protocol proceed, and how did you respond to the protocol?
So it started, we obviously had to travel to Malaysia, which, traveling is very hard for someone who's chronically ill. So that already takes quite a bit out of you. And then, so we got to Malaysia, and you have antibiotics intravenously for about 4 to 5 days. And then after that, you undergo the hypothermia treatment, which is the 42 degree Celsius heat chamber, which you lie in for about 7 hours, I'm pretty sure. And you get knocked out for that. So they put you on anesthetic, and while you're in the heat chamber, they are giving you antibiotics intravenously. And so the combination between the antibiotics and the heat is meant to kind of bombard the infection and kill it. So then after that, you have to recover because it takes a big toll on your body. And then after that, you have IV antibiotics again for about another 7 days. And then you have to return back to your home country. And then you wait about 2 months, and those 2 months are very terrible. I was very ill. I couldn't walk. I was vomiting every day, all day, and you feel terrible, worse than you went, because that infection is dying and it comes out in terrible ways. So then after the 2 months, you have to return back and do it all again. And some patients only go once, but he thought 2 would be the right amount to kill my specific infection. So we did it all again, and we came back home, and I was very ill. It took me months and months and months to recover from this, or get back to the stage I was before we decided to travel over there.
All right, so it took you months to get back to the point of where you felt before getting this this heat treatment and combined with antibiotics. I'd like to know when you woke up after the first treatment and you woke up from that sedated point. How did you feel when you woke up? What were your thoughts? How did you feel? I'm curious what that was like.
It was a very weird feeling, definitely. You felt really hot and you vomit a lot because your body's been through a very traumatic thing. But after the first time, I actually got very sick. My blood rate dropped, my heart pressure, dropped to about 40, and I went unconscious. And they didn't know how to bring me back, so they put me on blood pressure medication, which brought me back too. But I ended up having an allergic reaction to that blood pressure medication, which we never knew I was allergic to. And so that also put a big dent in the road of that experience, because I got very sick from that as well. And so there was lots of vomiting and things like that. And it takes you about 3 days until you can get out of bed into a wheelchair to continue the antibiotic treatment.
So let's fast forward. So a few months after your last and second treatment, you were finally back to where you were before. Can you talk a little bit about what it was like after those couple of months and how you progressed from that point forward?
Yeah. So after we got home, and it took a couple of months to get better, they was wondering what to do because I wasn't perking back quite like some of the other patients, because I was kind of back to that same place. So we kind of went along with the normal treatments, kept up my supplements, things like that. You had to be on antibiotics as well when you got home. So I just finished that third course of antibiotics, and we were on drugs to try and manage the inflammation and the pain. And we started doing IVIG to try and bring my fatigue levels to a good point. And the IVIG did really help to my fatigue in the time, but in the long run, it didn't make quite a big effect. We were doing CBD oil, physio, water therapy. We tried lots of things just to try and wait for the infection to die off. And then about 3 months after we got back, we did another blood test with the CDC, and it came back negative for Lyme disease, which was a good news that it had come back negative. So they were very sure that they had killed the bug. But what my doctor mainly sees in his practice is a lot of patients with what's called post-Lyme syndrome. So your body still has all the symptoms and the damage of Lyme disease, but you don't have an active infection.
The physio, that's physical therapy, right?
Yeah.
Did you find physical therapy to be helpful to curb some of the pain that you were having?
Yeah, 100%. I've got a great physio. I go once a week to see him, and he does release therapy because a lot of Lyme patients have a lot of built-up tension. He does releases like manipulation and cracking. He also does acupuncture, which has been a very useful tool in combating the tension and a bit of the inflammation, definitely.
So, Zara, how far out are you from the last treatment that you had, the last hypothermia treatment you had?
Ooh. I went to Malaysia in 2017, so about two years ago, nearly 3 years ago, because it was very early 2017.
So how has your health improved between the time you returned from Malaysia and today?
A lot of the muscle and joint pain has gotten a bit better, and the fatigue has gotten better. But, the symptoms really switch and change all the time, and it has definitely developed very differently from when I got back from Malaysia to now. We had hopes that it would have worked a bit better than it did, but we do think it was a vital step in healing from the Lyme disease.
So if you could turn back time, you would make that same decision again? You feel that was a worthwhile effort to go through that treatment?
Yes. Yeah, I would say so, yeah. Because it did help. I don't think there would have been anything else that would have killed the bug, because now we can deal with the damage that I have left instead of trying to combat the damage and an active infection. So I do think it was very worthwhile going over there. I mean, I could have had this hypothermia treatment in Australia, but they refuse to give it to people who have Lyme disease because they don't believe it exists. But they are more than happy to give it to athletes who have, broken their leg or something like that, but they won't give it to critically ill patients, which is a bit ridiculous.
So, Zara, why do you think Australia is so hesitant, or the medical community in Australia is so hesitant to acknowledge the existence of Lyme disease?
Well, as you guys probably know, it costs the government a lot of money to do the research for Lyme disease. So I think that's a part of it. And because once they open that door to saying that exists, they can't close the door again. So, I mean, it's becoming a big epidemic, and they're going to get to a point where they can't keep dismissing it. And now they're even getting to the point where they're taking licenses away from practicing doctors who are practicing Lyme disease treatment and things like that, which is just terrible.
Zara, that's actually very consistent with what happened here in the States. I'd say 10, 20 years ago, where we live, it was there. Even now it's happening, and it started probably 20, 30 years ago actually, with a very popular doctor out east here in New York, and he kept treating Lyme disease patients because he knew it was the right thing to do, and he almost lost his license. He had it suspended. He was reviewed by the medical board numerous times, and now he's a really popular figure in the Lyme community here because he just kept pushing and researching and treating because he really cared about his patients. So we can totally relate. And in Australia, Zara, does your government, we know they don't recognize Lyme, but do they provide any assistance or disability services to people with chronic Lyme or chronic illnesses like Lyme?
No, they definitely do not. They don't see it as a disability. They don't even see it as a disease. They see it as, if you don't get better after that, 3 or 4 weeks on antibiotics, then it's not Lyme disease. Or if it's Lyme disease, you didn't contract it here, so it's not our problem, which is crazy.
So, Zara, one of the things that inspired us to follow you and to invite you on the podcast is that you've not taken your government's and your medical community's decision lying down. You've created a beautiful Instagram page where you are, Instagram, right? You're supposed to say page, a beautiful Instagram where you are reaching out on behalf of the chronic Lyme sufferers, and you're connecting with and supporting chronic Lyme sufferers. Can you tell us a little bit about your decision to do that?
Yeah. So I was, being bedridden, you do have a lot of time on your hands. And I was scrolling through Instagram, and I saw lots of accounts, but a lot of them were American. And I thought, it would be such a good idea and a good way to connect with other people and to help people, because a lot of people with Lyme disease are not in my position where someone in their family has Lyme disease. So, I have that person who I can go to who understands and who can help me and give me advice, but lots of people don't have that. And then I also thought it'd be a great way for me to look back and, you know, see how far I've come, or kind of document, sort of like a diary, what's been going on. But I kind of didn't suspect that anyone would follow me, really. I just thought it would be kind of a little project for me to do in bed. But then I started getting people reaching out from all of Australia and America who their kids had been diagnosed with Lyme disease from in vitro, and people wanting help, like asking about their children, which has been really great. I've been able to help 4 kids get diagnosed with Lyme disease, an early diagnosis, and I've been able to help 2 girls from my local community get an early diagnosis, and one of them has already bounced back and is back in school, which is really fulfilling.
Hey, man, that's beautiful, Zara, that you've been able to turn your challenges into a way of serving other people, and we really admire you for doing that. So, Zara, what advice do you have for folks who have been diagnosed with Lyme disease?
I would just say, you know, there is hope for a lot of people, and, you know, you're not alone, and, you know, it's okay to come to terms with what's going on, and there's, you know, a big part is grieving the old life, you know, what has happened to you, and because it's a lot of emotional stuff as well, because it does take a big toll and your life gets stolen from you, basically. So that's what I would say.
Well, thank you, Zara. This has been an inspirational interview for both me, Matt, and all of our listeners, and we are really blessed to have you share your experience with us. To our listeners, we have a call to action. First, if you'd like to learn more about Zara Toohey, please visit her Instagram, Lyme__life. Second, if you enjoyed this episode of the Tick Bootcamp podcast interview with Zara Toohey, please share it with your friends by using the social media button at the bottom of the post. Third, don't forget to subscribe to this podcast on iTunes, Google Play, Spotify, to get the automatic episodes updates for the Tick Bootcamp podcast. And finally, please take a minute to leave an honest review and ratings on iTunes. This is a new effort on our part, and we could really use your help. We'd like to produce a podcast that you'd like to listen to, and we make a point to read every single one of the reviews we get. Thank you for listening.